Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. In 2017, I launched RevitalyzeMD with a mission to help patients find solutions to feeling, looking, and functioning better, those solutions that traditional medicine just did not have. I am a traditionally trained MD that worked in the emergency room for 25 years, as that's my specialty. And as I worked in the emergency room and myself was functioning differently or noticing changes in how I was looking or feeling or functioning, I realized that I wasn't alone and that there were colleagues and coworkers and even patients that felt the same way. And at the end of long workups, it was always the same. Everything looks normal. And so as I began my journey into anti-aging medicine greater than a decade ago, it was because I was finding that there were all kinds of solutions to looking, feeling, and functioning younger. And I wanted to bring those to patients comprehensively. So welcome to the podcast. Hopefully with this podcast, we can also get that message out to more people. So welcome today. And I have a couple guests with me, and it's part of my team as well. So I'm going to let them introduce themselves. So Rachel, do you want to?
Hi guys, I'm Rachel and I am a CCMA here at RevitalyzeMD, a medical assistant. I have been working with Dr. Durst and the Revitalize team for about a year and a half now. It's really opened my eyes to all of the different options that are out there that you normally just do not know about. And so I'm really excited to be a part of Revitalize and just helping our patients to look and feel better. So I'm Rachel and I'm excited to be here.
Hi everyone, my name is Samatha. I am the office manager at RevitalyzeMD. I've also been with the company for about 2.5 years or so, and I also agree with Rachel that it opened my eyes to things I did not know about before coming into this field. So I enjoy making sure that patients feel their best from the inside out.
Well, today we were going to go ahead and maybe touch on some things and kind of just have an open conversation. Nothing really planned out specifically, but on just how to think outside of the box. And so I might even let Rachel segue us into this topic. What is one thing that comes to mind with you when we start talking about medicine and thinking outside of the box?
Well, I see our patients every day and how they come in and they are all experiencing the same symptoms, feeling the same way. They're complaining of being tired all the time, weight gain, hot flashes, night sweats, just not functioning as well as they once did. We even see patients as young as early 30s, which may be a shock to a lot of people, but that's about the time where they start functioning less and less over the years. And so we see that every day, and they come in and they've been to their primary care, they've been to their OBGYN, and they all check their labs and they say, oh, you're within normal range, but they know that something is not right. And so they find us and they come to us, and Dr. Durst takes care of them, and we break down their labs. We see what is going on, and we look at their symptoms, and a lot of times it's just all hormone related, and we just really we're all taught a certain way, and we just don't know that there's options out there. And so that's one thing that I really love about Revitalize and Dr. Durst is that there are options, and we're not limited to those options. We have a lot of different things, and everything is tailored to the patient and how they're feeling, how old they are, and their labs, what they look like. And so there's a lot of different options, and that's what I really enjoy is seeing these patients come in and how they're feeling, and then just within a few months how they've changed and how they are feeling so much better, and they're so happy with what plan they're on, and they're just feeling great.
Do you feel like a lot of patients feel limited by traditional medicine models and who their primary care doctor is and what they can receive in a primary care setting?
Yeah, absolutely. In insurance, they tell you what doctor to go to, what they can do medically with you, what medicines you need to be on, and different things. And so, yeah, absolutely. They are just really limited. And, like I said, that's what I really love about Revitalize. Like, we're not limited. And, that's what's so great about it.
Rachel has had a lot of experience, comes to us with a lot of experience, and we really have appreciated that at the office. Me especially. She's a rock star. She is awesome at everything that she does, but she comes to us from some primary care offices. And so this is her first time outside of traditional medicine in a non-insurance based model and office. So she really can speak to what she has seen in traditional offices. And so, again, I think that patients don't always know that there is something else. But I honestly think that that's changing quite a bit. And I feel like patients come in more proactive than physician and providers in this area because they get those answers. But then day in and day out, we are seeing patients that are sitting in front of us saying the exact same thing.
Yes,
every
day.
Everything is normal, but I don't feel right. And they end up in front of me for a reason. And that's because they're on the internet and they're looking for solutions. And so those solutions are sometimes hormone replacement or even just functional medicine, integrative, looking at other lab tests, maybe GI stuff. So we're going to touch on some of that. And so some of the different options or where people would go. So let's talk about, for instance, medicine, some complaints, like fatigue, for instance, and frequently that energy drop or fatigue and even brain fog go along with it, sometimes weight gain. And so what did you see happening in a primary care office when that happened?
They would check their labs and they would say, oh, everything's normal. You need to exercise more, when these patients are already exercising every day. They're already eating right. And then they want to put them on some medication. Honestly, they really just tell them, you have to eat a certain food, a certain amount of food. You have to work out every day. And those patients are feeling frustrated because they're saying, I've already done all these things. I'm working out every day. On a diet. I've been on a diet for years and years, and I just keep, packing on the pounds. They won't come off. And a lot of times it's, hormone related, and they just don't deal with that. Those, primary care or OBGYNs, they don't really deal with that. So, that's when they're like, well, really, they don't know. They just are trained a certain way, and that's it.
Yeah, so they end up doing some basic blood work, and, I've been, every day I hear it again, that everything looked good. Yep. And so even with hormones, again, Rachel and Samantha have seen this over and over again, that, good and normal in a range is not what we're looking for. We're looking for optimal. And so we want to optimize hormones and not just keep you in that normal range. So, for instance, there'll be a number for your age that's right in the middle, and that's an average for your age. And then there's 2 standard deviations above and below, and that's still a normal range. So say one is 250 and one is 900, and that's your range. That means that anywhere in there is normal. And so you could be 800 and now you're 300, and that's still normal in traditional medicine. And that's true. It's in the normal range, but that might not be optimal for you. And that's why you're feeling different. And so we deal more with optimals and not with normals. And so then, that's one of the differences, which is why, so they're not wrong in telling you that you're normal and within a normal limit. And then thyroid frequently is another thing that is looked at and frequently told that they're normal as well. Yeah. And you're right. We hear over and over again that, I'm doing the same thing. I'm eating right. I'm exercising. And again, I haven't changed this, but now I'm still gaining weight despite that. And I didn't used to be. So something is going on as we age that is causing that to happen, right? Because they're not doing anything differently except aging. So, again, hormone decline just means it's different than it was, but not optimal. And so even if we talk about thyroid for a few minutes, like Rachel knows that we're using more products of, compounded or combination products where it is Armor or Nature. And when they come to us, they're on levothyroxine, right? Which is, typically a T4 product only. And that brings us to even the endocrinologist. So when patients come in, they have seen an endocrinologist for hormones and even their thyroid, and they place them on those usual medicines, right?
Absolutely. And, a lot of times it's not functioning like it should. But, they just want to place them on the levothyroxine, like you said, and that's it. They don't want to help their thyroid to work,
Optimally.
Yeah, and to help it function on its own. So, absolutely.
And we can go into an entire, podcast series on just thyroid alone. And at some point we will. But if we're looking at thyroid testing in traditional medicine, you're looking at a TSH, maybe a free T4. And so, but what you learn in functional medicine, integrative and anti-aging medicine, whatever you want to call it, is that we're looking at free T3 as the more active hormone. And so that's definitely something you want to measure and something we do measure. And TSH is just another component of that, but it doesn't tell the whole story. So if you get a TSH level, and I know that frequently those that are listening have gotten that before, and it's normal, but then free T3 may not be normal, or even if it is normal, may not be optimal. So again, we're going for that optimal range. So we have women all the time that come in. Weight gain can be a function of a low thyroid or a non-optimal thyroid, and it can be what we call subclinical hypothyroidism. And so we can place people on a combination product that has T3 and T4 in it versus levothyroxine, which is just T4. And then cold all the time is one of the symptoms. And hair and nails are unhealthy, or, the outer aspect of our eyebrows starts to thin. So again, we'll go into a whole segment. I think that's probably more appropriate on, thyroid, but that's just one key difference between us and traditional medicine, and that's an endocrinologist. And so when you think of them, they're your hormone specialist. So that should be somebody you should go to even for male and female hormones, and they should optimize that in thyroid too, but they're still placing people on levothyroxine. And again, that's how we're trained. But in actuality, T4 is necessary, but T3 is the more active of the hormones. And so of the thyroid. So just differences that how we approach things versus traditional medicine. And then what about surgery?
You can go first.
No, go ahead. Did you?
One other thing is that I've noticed that people complain about like having no energy or they're fatigued, and their primary carers put them on an antidepressant or anxiety med. What is something that we would do instead of that? So an alternative to that.
Well, that brings us into a big thing, because like not only the primary, but the gynecologist. So, again, Rachel is like, again, our point person at the office, that is talking with our patients on a daily basis. We probably see this a little bit more commonly in women than in men, although the energy, fatigue, weight gain, and libido and some other stuff, are more common for men. But for the women, they don't sleep as well.
Yeah.
And they don't, they get anxious, or they don't handle stress like they used to. And anything can make them upset, where that wasn't the case before. So the first thing that happens when they see the primary, like you addressed, Samantha, or a gynecologist, they're placed on antidepressants, anti-anxieties, and sleep medicine. And so we don't become deficient in that. And so instead, I'll let you guys even talk about the couple of things to replace, because you've even mentioned it before with, one of them, and the feel-good hormone is one. Yeah. So, and even Rachel can talk about that, like the progesterone is our feel-good hormone for women. And so frequently they're low in that. And we're starting it, we'll start it with capsules, sometimes if it's a sleep issue, but again, sometimes if it's more an anxiety, cream might be appropriate. We just don't do pellets of progesterone, because that is not a good option for a couple different reasons. But and that helps them sleep. So they're not deficient in drugs or medications. They're deficient in hormones. And so progesterone tends to be the big one there. And so, again, that's actually a good hormone. It's estrogen that can kind of like work against all that. But progesterone is a necessary feel-good hormone for women. And so,
absolutely. And, when you do go to your primary care, it's like they want to start you on all these medications just to keep all your symptoms kind of at bay. They don't want to help them.
I feel like they make them worse, though.
Yeah. And so they do, like you said, Samantha, want to put them on antidepressants or anxiety medication. And, a lot of times, like you said, once again, the progesterone, that's your feel-good hormone. That's going to help you sleep. It's going to help you feel good. So, you are just needing progesterone or, your hormones in general. They're just out of whack. And we need to take care of that instead of putting you on all of these different medications. That's just going to make you worse. It's going to help everything that may semi-function to not function anymore on its own. And so I think that's just another point.
It's a very good point. And again, you don't become deficient in anti-anxiety, antidepressants, and sleep medicine when we hit 40 as women. We just have a decreasing progesterone. And really, Rachel, you point that out, that it's a balance between estrogen and progesterone at that point. And so it's really that your estrogen's still high, your progesterone drops. So your progesterone may sometimes not even be out of the normal range, but it's still lower than it was and out of balance with estrogen. So we become what's called estrogen dominant at that stage. So brings us to gynecologic issues. So frequently in that, you have a estrogen that's high and a perimenopause and a progesterone that just isn't balancing it appropriately. So we want to optimize the progesterone again, but they'll have vaginal bleeding or fibrocystic breast disease because estrogen tends to proliferate tissue. And so you'll get some fibrocystic breast disease, maybe breast tenderness, but really they get frequent like fibroids, uterine bleeding. And so you'll see ablations at this time, lots of hysterectomies done, during that period where a lot of times maybe optimizing progesterone for a period of time, not a short period of time, but for a longer period, once those conditions are present, can actually improve that. And so, and you see that frequently as, we're trying to balance menopausal patients that they might have those complaints, breast tenderness and bleeding, just because we're giving them estrogen and that we haven't yet gotten the balance between estrogen and progesterone perfect. And so
we see that a lot, especially, kind of in the beginning. And that's what we, when we have our new patients come in, we really like to stay in touch with you, talk to you, all the time. It's very important to, let us know how you're feeling, especially in the first few weeks after we do, whether we do pellets, creams, or, capsules, anything like that. We do want to stay interacted because a lot of times they'll start having some breast tenderness, some bleeding and different things. And, like Dr. Durst said, that's normal, and we just kind of have to get that right balance. It is good to, stay in touch with our patients. And that's, a goal of ours at RevitalyzeMD is just to patient care. You guys are like family. And so when you come in, that's how you're going to be treated. And just staying in touch with you guys. I mean, even if you want to text us at 10 o'clock at night, if you're having an issue, one of the girls will respond to you and just let you know that, what you're feeling, it's okay. And we'll work through that together to get it right for you. And that's one of our main goals, too, at Revitalize.
And I think that is, again, thinking outside of the box, kind of what we started this about is that, what this podcast is trying to address is thinking outside the box. So, again, traditional medicine doesn't allow for, instead you have insurance companies dictating your relationship with your physician. And so the reason why that would not work in what we do, which is a more comprehensive wellness, is that we can actually personalize that journey with you. And so we're frequently in touch. And so these girls are awesome about getting back in touch with you. You know, you're going to get to know us well, especially in the first, you know, quarter or first, you know, few months of us balancing hormones, because we're going to be in touch probably more than you want to. I always tell patients they're going to get to know me well, and I'm going to get to know them well. They're going to get to know the staff well, and we are in touch, and that does set us apart from traditional medicine, which dictates how often. So they might write a medicine and see you in 6 months, an antidepressant, and, you know, a sleep medicine see you in 6 or 12 months. They don't have the ability to personalize that and bring you in more frequently because, the insurance company does not allow for that. And so that's what's nice about thinking outside the box too. And just knowing that there's options, as, you know, Rachel pointed out, that there's options outside of traditional medicine if you're committed to wanting that, you know, solution to feeling better, looking better, functioning better. So, and then as far as men, you know, they'll frequently see a urologist and, you know, some frequent complaints. And again, Rachel sees them at the beginning and throughout, but some frequent complaints that you hear from men more specifically.
It's always funny with men. We have a lot of men that come in. Probably 50% of our clientele are men. But they're always a little nervous when they first come in. They're like, well, I shouldn't be here, you know, but we always make everybody that comes through the door feel very welcome. And, you know, no question is a dumb question. You know, you're here for a reason, and it's normal to come to see us, you know, because you never get it corrected with your primary care or OBGYN or urologist. So a lot of times men will come in and they're feeling the same, you know, some similar things to women, but they're feeling, you know, very fatigued. Their libido is very low. A lot of times they're losing muscle mass, is another big one for men. You know, and they're just not feeling the way they once did. A lot of times their testosterone's really low, so they're just, you know, they just don't feel very manly anymore.
And a loss of masculinity is, you know, one of our intake questions, because, and then again, a loss of muscle mass. And weight gain around the middle is very common. Truncal, and there's a whole nother, again, podcast we can do just on metabolic syndrome, which is pretty common as hormones decline and the blood pressure goes up and our truncal obesity or subcutaneous fat goes up. So, that whole loss of masculinity, they don't have the drive they used to, and really testosterone is a life force for men. And so it's actually a life force for women too. But, you know, that, so if it's low, they just don't feel that drive, that competitive edge they used to have. You know, they get a little depressed because they don't feel that way.
Absolutely.
And if they notice any functional changes where, you know, erectile function isn't quite the same, even if they're losing it midway, even if it's an occasional, it's a difference for them. And definitely they lose the confidence that they once had. So
absolutely.
And then, you know, the other thing with thinking outside the box, not only are we looking at tests that can, you know, that look at hormones and optimize them, like traditional medicine doesn't do, but you have shots. We have shots in the office. You can
many
do
options.
You know, fat burning shots, and you know, offices will call them different things, whether it's mega burns or lipo burns, and then, you know, amino acid shots, antioxidant shots, you know, all kinds of supplements that go along with the shots. There's things you can do at home. So in addition to hormone optimization, we have other things that are definitely outside of the box. So
and so many options, so many different options. And like you know, like we've all said before, you just feel like there's always a limit to the different things that you can get, the different things, you know, how you can feel in different things, but there's no limit. So if, you know, you're listening to this and you just feel like that you're just all out of options, you're not. Definitely come see us and give us a try. You will not be disappointed. Our office is great. You know, from the time you walk into the door, you feel very welcome. So don't feel scared. Don't feel ashamed, because everyone deals with it at some point in your life. And so
it's inevitable, you know, that we'll have changes. I mean, it's very common. And so some of them are a little more insidious. So I hear frequently people in their 70s even complaining of no, brain fog and no energy decline. And to me, I think that's probably just because it's a more subtle decline. And so once we optimize them, but they're still in front of us for a reason.
Yeah.
And so it might be a different reason. And so as we optimize, then those start to improve as well. And so it was just a more insidious, not a rapid decline. So, and then, so even if we're talking about surgeries, like for instance, and we're, again, talking about thinking outside the box. So traditional stuff you might seek out, and now how we might be different, or things that we can do that are different, that are non-traditional, outside of the box. So surgery is another thing. We're talking about specialties now that you might go to. So you have an acute orthopedic injury and you're having pain somewhere. What are the options that you're going to get if you see an orthopedic surgeon?
Really?
Cortisone shot.
Yeah. Or they're going to want to do surgery.
Steroid shot.
Yeah. They go straight to like really what should be the last resort. First, exhaust all the other options. And so we offer so many different things at Revitalize, but anytime that you're going to be having surgery, we have a lot of options. And so, even with like our lasers and stuff, just with pain, we have a lot of patients that we see that, shoulder pain, just joint in general, tendons, a lot of pain. And so we have, different options for you, lasers and different things, peptides. A lot of great options that we have a lot of patients on, and they have improved so much, and they're so thankful because now they don't have to go through with surgery.
And so I think that even when you're looking at acute injury or even a chronic injury and surgical options, so if you go to the orthopedic doctor, again, frequently you're going to get a diagnostic test. And, again, that'll give you a diagnosis, whether you have a tendon, maybe tear or rupture, a steroid shot for improvement, maybe some temporary anti-inflammatories, maybe some pain medicine. And so we don't use a lot of those. And again, you may still end up in front of the orthopedic surgeon, with all those traditional options. But first, some things we'll try is, again, a laser, which kind of focuses in a little bit deeper. We use the laser beam to bring stem cells to the area. And then sometimes we can do PRP, in those areas. We have, stem options too, if people choose to, pursue that. But likewise, we can do peptides. And so when Rachel was talking about that, BPC, we've talked about many times on here, that's a body protective and repair compound. And so we'll use that in conjunction with the laser to try and get some improvement. And again, I would say that probably 9 out of 10 times with what's going on, we can get improvement.
Absolutely.
And so for that 1 out of 10 times we can't, you may still end up in the orthopedic office with diagnostic tests and other options, but at least you've exhausted non-surgical and non-medical ways of improving it beforehand. And so, and then even surgical stuff, again, we touched a little bit on just, GYN and ablations and hysterectomies for vaginal bleeding, but even men for erectile dysfunction, for instance, sometimes with Peyronie's, there's medicines they will inject, but there's things we can do non-surgical with PRP or Gainswave to improve that condition without surgery. And then again, progressive erectile dysfunction, ultimately it is progressive over time. So once it starts to happen, it does progress. So you want to get in and again, not look at that as a shameful condition, but instead that you're being proactive and taking control of that before it does progress. And so the earlier you get in, the better, because then we don't have as much recovery to make. But the end result, if you don't do anything, is surgery and medicine. And so, implants or medicines you have to inject long-term for sexual function. So, those things aren't conducive for, spontaneity and sometimes it's painful. So again, we want to do things that are non-surgical options. And that's kind of what sets us apart from, I'm not a surgeon. So that's probably part of but I'm also just anti-medicine and I'm an MD. I just don't like to use medicine unless we have to. And I do have that option of using it if necessary. And then what other specialties or traditional stuff might they seek out that. And again, peptides work with a lot of things. So even primaries and autoimmune disorders and GI disorders. So a lot of people are on acid reducing medicines, and we'll see that improve with BPC use. And then, so peptides help with a lot of things. There's so many different options to it.
And the peptides, like you said, there's a lot of different things that it helps with too. So it's not just, BPC is not just for, tendon healing, it's inflammation, it's bone health, there's so many different things that the BPC, the peptides, they help with as well. So it's not just one thing. They're very good, for different reasons.
And even if you do end up needing surgical repair in a surgery for an acute injury or even a GI issue, where surgery is necessary, then using BPC both in the perioperative and postoperative allow for better healing. And so, it just gets you out of the hospital more active quicker. Aesthetics is another thing. So if we just talk about, that's another area where the plastic surgeon, for instance, does a great job of aesthetic, improvement and getting us looking better. And so, they're skilled as can be. And again, when we have, body changes we want to do, that they're perfect for getting us those, beautiful results. And likewise, if there's facial, facelifts they want to do, or, fat transfers or even injections, they're awesome about that. But again, a lot of that isn't sustained if your hormones aren't optimized. And so I kind of look at that more comprehensively, where I like to do a lot of laser regenerative stuff. And I'll let Rachel and Samantha talk about even the more general aesthetics that is regenerative, microneedling and pills and non-fractional lasers. But then also, just optimizing hormones so that the results that you are getting for whatever you're doing are comprehensive and sustained.
I will agree with that for sure. I think a lot of times you aren't feeling good, but you want to look good. And I think you need to reverse that. You want to, make yourself feel better, and then you want to look better, because you're going to look better when you feel better. So I think, it's good to get hormones balanced and all that. And then also start treatments as far as microneedling, Morpheus, skin pen. We've got many different options, lasers and different things that are going to also help you to look better once you've started feeling better.
We have all the other non-surgical options, Botox and fillers for volume loss, and threads for, lifting, and non-surgical options, and then lasers that are a lot of non-surgical regenerative. But again, even if you're seeing the plastic surgeons, which are awesome at getting you the results that you want, even if it's, with non-surgical means, but really adding in what we do as a comprehensive. And then we do a lot of IV therapy too, which helps with aesthetics and detoxing, and even glutathione as an IV drip is used frequently in Hollywood for, skin brightening and detoxing the skin and making it healthier and brighter. And so there's so many different things that complement, and again, are outside of the box of ways that you think. So I think that the goal, even with aesthetics, is to go in and let them know what you want, but then they're going to kind of let you know what you really, the best methods of getting those are. And so no matter where you go, I think that you still need to have that inner, balance and optimization. So cell health is important, IV therapy, nutrients, and then again, hormone optimization. So anything else traditional outside of the box that anyone can think of that we didn't hit? So again, I think if you comment, we're just kind of going through different ideas of, non-traditional ways to address some issues or concerns that you might be having, and thinking outside of the box. So if there's anything else that you have questions about that you would like us to address in future podcasts, please just comment. Or send us a message. And I think Samantha's better at this part than I am.
Call or text the office to schedule a consultation. We can do that all online or over text as well. So that's really the next step, to just find out what you need to do to feel better, look better, and go outside the route of traditional medicine.
Yeah. And no question is a dumb question. And don't be ashamed or scared, because we hear it all. And, you know,
everything they feel is normal.
Everything that you're feeling is normal.
And we're not afraid to talk about anything.
Yeah,
right?
no.
At all. So we'll deep dive into anything aesthetics, again, wellness or sexual wellness. So if you're listening, you know, if you rate, give us some feedback. And if you're watching, you know, just make sure you leave in the comments anything you would want us to address. And then, you know, subscribe, hit the like button, the bell, all of that fancy stuff. And so anyhow, again, so thank you for joining us. And we're here just to revitalize your look, your health, and your sex life.
Thank you.